Well, good morning, good afternoon, and good evening to wherever you're joining us from. Welcome, everyone, to this three-part webinar series titled Breathing into the Future, Creating Healthier Indoor Spaces for Resilient Cities and Communities. We're really excited about this very timely discussion. Did you know that we take around 22,000 breaths a day on average and spend over 90% of our times indoors? Yet we never think about the quality of the indoor air that we're breathing, nor its implications on our health and well-being. Today, we start with an opening session to discuss just that, joined by a team of experts to dive into both the challenges and the opportunities, global and local. This webinar series has been designed by Goumbook. Goumbook is a social enterprise focused on accelerating sustainability and climate action in the UAE and beyond. This conversation comes under the umbrella of the Take a Breath initiative. Take a Breath is an initiative by Goumbook endorsed by the UAE Ministry of Climate Change and Environment for its alignment with their Air Quality Agenda 2031 and is run in partnership with Opella Telfast. This webinar series is a gathering of an expert network of speakers and multi-stakeholder audience to drive collaborative action to improve indoor air. My name is Lama Saleh. I'm the Director of Partnerships and Program Development at Goumbook, and I'll be moderating this session today. We are joined by an all-star list of experts. We have Dr. Hiba Safi with us. We have Dr. Khulud Al-Tassan, Dr. Vahid Husseini, and last but not least, Mr. Frank Hammes. Each of the speakers will be bringing their insights and expertise to this session. Also, we will be concluding the session today with an open Q&A. We will try to direct one question per speaker. We'll try to answer as many of your questions as possible, but we'll do at least one per speaker, hopefully. This session's also recorded, so you can go back to the recordings afterwards and tune in. So first up, we would like to introduce our first speaker, Dr. Hiba Safi. Dr. Safi is a technical officer on air quality and health from the regional office of the Eastern Mediterranean region of the World Health Organization. She's part of the Climate Change, Health and Environment Unit and joining us from Amman, Jordan. Dr. Safi, as an environmental health professional and toxicology expert, specializes in air quality and chemical safety. She's been advising 22 Eastern Mediterranean countries via the WHO and generating scientific evidence for health policies to mitigate pollution and environmental hazards. Dr. Safi today will be taking us through the context of air quality and its linked to health. The floor is yours, Dr. Safi.
Many thanks, Dr. Lama, for the kind introduction, and hello, everyone. Glad to be here. So in my talk in the upcoming 10 minutes, I'll give an overview or a brief on air quality and health, focusing on the WHO Eastern Mediterranean region. Before going through the health impact of air pollution, allow me to introduce the region to you. WHO Eastern Mediterranean region is a home for more than 700 million people distributed across 22 countries in the region. The countries are distributed among the African continent, Middle East, and Iran, Afghanistan, and Pakistan. And as you may notice, that the countries are quite diverse when it comes in socio-economical indicators, but they are sharing several elements, mainly facing the huge burden of environmental health risks, particularly climate change and air pollution, affecting or by natural emergencies and political conflicts, which exacerbate the environmental health risks and poses extra challenges in dealing and reducing the health burden of these environmental risks. In addition, that the issue is that we are facing that environment and health policy making are siloed among several countries in the region, that we are calling and advocating for health action beyond the health sector, which is to take interventions by other sectors to address or include the health agenda among environmental policies and strategies. According to the latest WHO estimates, around 1/4 of the total natural deaths across the globe are due to environmental health risks, which equals to 13 million deaths, premature deaths actually, including 1 million from our region. The pie chart elaborates the contribution of each environmental risk to this number. As you can see, air pollution contributes to more than 56% to these deaths, followed by exposure to selected toxic chemicals and occupational risks. The fact that climate change is happening faster than we are expecting, and it's impacting and exacerbating the health burden of these environmental health risks. Air equality, WHO in 2019 estimated the health burden of air pollution, both ambient and indoor, the combined effect. The figures, according to the latest estimates, around 6.8 million annual premature deaths are associated to air pollution, of which more than 500,000 from our region. However, IHME estimates in 2021 is a bit higher, which estimates that 8 million premature deaths are related to air pollution, of which more than 600,000 from our region. And those numbers are related to 5 main health outcomes, where there is strong and mature, let me say, causal relationship and epidemiological studies on the exposure to air pollution, different key air pollutants, and the health outcomes, which are ischemic heart disease, stroke, COPD, acute lower respiratory diseases, and lung cancer. However, there is a strong belief that these figures are underestimated, as the epidemiological studies for other health outcomes are still evolving. WHO is mandated to regularly update its air quality database. In 2022, we released the latest version, and now there is an ongoing update for the database. This database is estimated the population-weighted exposure for particulate matter 10, particulate matter 2.5, and NO2. The figure here elaborates the population-weighted exposure for the 3 selected key air pollutants over the period of 2010 to 2019 among all WHO regions, and the estimates are available at the national level. As you may notice, the Eastern Mediterranean region has the highest PM10 concentrations and the highest NO2 concentrations, and the second highest particulate matter 2.5 concentration. And the justification for this, that when it comes for the particulate matter, the Eastern Mediterranean region has a distinguished, let me say, component of the air pollution, as the natural sources contribute to up to 50% of the total annual concentrations. However, anthropogenic sources like industry and transportation is still considerable and should be tackled. The lower part of the graph elaborates the number of ground monitoring stations. As you can see, our region is the second lowest number of ground monitoring stations, and this is one of the gaps that we are working on in our region, that to expand and strengthen the air quality monitoring stations. In addition, we regularly update and estimate the health burden of air pollution, whether deaths or DALYs, daily adjusted life years. I selected to present the air pollution attributable death rate in 2019, the latest estimates. The graph elaborates the ambient attributable death rate in orange columns and the household air pollution attributable death rate and the gray one, as well as the combined air pollution death rate in the 22 countries of the region. As you can see that the least developed countries are mainly facing the household death rates, not ambient, but it's due to the household air pollution, which is to rely on unclean fuel and technologies using for cooking and heating and lighting at indoor settings. This just as well to elaborate the household air pollution attributable death rate in our region, which is similar a bit to the previous one. Indoor air pollution, as WHO identified, this slide elaborates the, let me say, main sources of indoor or household air pollution, which particularly in low and middle income countries, which includes but not limited to insufficient fuel combustion for cooking, heating, and lighting, which generates particulate matter and noxious gases. In addition to secondhand tobacco smoke like shisha or cigarettes or e-cigarettes, as well as molds and which release some VOCs and other compounds, chemical compounds, which affect the health, as well as the ambient air pollution, as there is a factor between ambient and indoor air pollution that we are exposed to in indoor settings. WHO as a custodian agency for several SDGs related to air equality. Among these SDGs, we do the reporting for SDG 7.9.1.2, which is there is reliance on clean fuels technologies only for cooking. And you can see most of the globe are relied on clean fuels and technologies, but the Southern African countries are mainly using unclean fuels and technologies for cooking. WHO is very keen in updating its air quality guidelines, whether for ambient or indoor air quality guidelines over the period. We developed several versions of the ambient air quality guideline and make it from a European region guidelines to make it a WHO global air quality guidelines to apply for all countries at the global level. In addition, we do have three specific guidelines for indoor air quality. The first one on dampness and mold. The second one is related to selected air pollutants, which includes formaldehyde, nitrogen dioxides, also phthalates, benzene, hydrocarbons, radon, and some other selected pollutants, which the evidence shows that there is an impact or health impact due to exposure to these pollutants. And the most recent indoor air quality guideline, which is the household fuel combustion, which is the first ever health-based guidelines on clean fuels technologies for household, for cooking, heating, and lighting. These guidelines aim to help the public and policymakers to understand and implement best approaches to reduce the indoor air pollution levels as well as to reduce its health burden. It presents as well the latest evidence related to the health impact of exposure to each of the selected pollutants, mainly, of fuels and technologies, mainly kerosene and other types of technologies for heating, cooking, and lighting. The last thing, just to mention that in addition, 2021, WHO updated its ambient air quality guidelines, which is applicable for indoor settings. So what applies for ambient air quality applies for indoor air quality settings. I'll stop here. Many thanks. I only to present best advice for the audience for tackling household and ambient air pollution for policymakers or for individuals. I thank you.
Thank you very much, Dr. Safi. This was really insightful. We got to better understand the impacts of our exposure to poor air quality and the regional challenges. Um, we are excited now to introduce you to our next speaker, Dr. Hosseini. Dr. Vahid Hosseini is the lead on transportation-related air pollution at the United Nations University Institute for Water, Environment and Health, joining us from Vancouver, Canada, which is quite early over there. So thank you so much for joining. Dr. Hosseini's research focuses on emissions from transportation, their impacts on air quality, and the decarbonization of urban mobility, to add to the former conversation from Dr. Sabri. With years of experience, Dr. Hosseini has contributed to the development of science-based policies aimed at reducing urban pollution from anthropogenic sources. So Dr. Hosseini today will be taking us through the distinction between natural and anthropogenic particle pollution linked to diesel combustion, among other things. Over to you, Dr. Husseini.
Good day, good evening, everyone. I think thank you very much for the nice introduction. The title of my talk is Take a Breath, the Future of Indoor Air Quality in a Changing Climate. My name is Vahid Hosseini, and as mentioned before, I'm the lead transportation-related air pollution at UNU INWEH, and at the same time, I'm also an associate professor of sustainable energy engineering in Simon Fraser University, Vancouver, Canada. Here's a bit of background about me. I am an expert in combustion and combustion-generated air pollution, do a lot of air pollution science and emission inventories and air pollution dispersion modeling and developing policies for sustainable transportation. The picture that you see is beautiful Burrard Inlet in Vancouver. I encourage everyone, if you can, come and visit this beautiful city. My research lab is Create Lab, and there's a QR code on the screen if you want to learn about our research projects. Today, very briefly, I will introduce the UNU, and then we'll talk about the climate change and air quality, what entails in terms of changing climate and what will be the impact on air quality, try to differentiate between natural and anthropogenic sources. I will allude to more efficient buildings in the future of climate, and then my interest is more on transportation, so I have a few slides on the transportation. UNU is a global system of research and training institutions of the United Nations University, which is the academic arm of the United Nations. You can see that it's covered. It's hosted by several countries of the world. There are institutes and operating units. As you can see, our institute is in Richmond Hill, Toronto, Canada. I'm joining from Western Canada, Vancouver. And here is a bit description on the background of UNU and our institute in Richmond Hill. You can see that we are working on the most pressing water, environmental, and health problems around the world. And we participate in webinars like this as part of our knowledge dissemination activities at UNU. We had a wonderful opening to this webinar by WHO, and you've seen the issues with the air quality, so I'm not going to explain all of those. This slide is taken from Goumbook website. As you can see, nicely summarizes all of the impact of the air quality and air pollution. I looked at a recent study in the region, in the Middle East region and Mediterranean region, and looked at the air pollution burden of disease over highly populated states in Middle East. And as you can see, the number is staggering, just related to the long-term exposure to particulate matter in the region. So I'm looking at the impact of the climate change on air quality. Air quality as it is, we have seen that there is an issue, but what would be the impact if we have a warmer climate under global warming in future? So of course, the higher temperature will increase the ground level ozone concentration, particularly in cities in our region. We have more frequent wildfire. Pretty much all of us are aware of the huge fire that we had in Los Angeles, California, a few weeks back, but these are occurring more and more intense fire. And of course, particulate emission is one of the byproducts of these huge wildfires. We will have longer pollen seasons, especially in countries with that are covered with forests and susceptible to these kind of pollution. There is also disruption in the atmospheric circulation. So we have prolonged episodes, inversion episode in which we have more stable air in cities. There's also a shift in precipitation patterns, drought, dust storm, and airborne particles. These images are from Lake Urumia in Iran. Actually, our director, Dr. Kaveh Madani, is an expert on Lake Urumia. And as you can see, just by looking at the picture, you see the difference between the lake in 2005 and 2013 is pretty much dried out. And again, as byproduct of these drought on many lakes around the world, and this lake particularly, we're going to have air pollution, mostly sea salt and other contaminants floating in air and impacting neighboring cities and environment. So generally, we will see that there are a lot other consequences of global warming. So it's bad as it is in terms of the air quality, but the future picture is not really promising. If we have a warmer climate, then we are going to have issue with air pollution. So just alluding to the topic of natural versus anthropogenic pollution, I found a recent study. This is a brand new study, it's 2024 in Middle East. And as you can see, they kind of differentiated between the sources of PM 2.5 and PM 10, so smaller particles versus larger particles. And as you can see, the contribution of mineral dust or dust in general to larger particles is more. So that tells you probably that nature produces larger particles, human are producing smaller particles. I did a study myself in Tehran in Middle East, and as you can see, there's a huge contributions of elemental carbon into particles and very small fraction of dust in the particle. These samples, bottom slide, were taken from cities, so highly unlikely that there are anthropogenic sources. So you can see the impact of combustion. Elemental carbon is a product of poor combustion. And we are facing both anthropogenic and natural loss. This is another study in 2012. As you can see, the red and orange colors are showing the dust, but the blue ones are showing the anthropogenic sources. Everything else pretty much, including anthropogenic sources. So we are facing a climate change with natural dust, as I mentioned, larger particles and human-made particles, mostly from combustion sources. Now, in terms of size comparison, I want to show you this very interesting infographic that you can compare different kind of particles with, a piece of human hair. But the part of this picture, I want to emphasize on the dust particle. As you can see, the relative size of a dust particle is around 2.5 micron and below. But going down, even smaller particles are generated from wildfire smoke. And so it used to be for the nature to generate larger particles. Now we did these wildfire smokes where the smaller and smaller particles that are more toxic for human health are generated by nature as well. Does it really matter we have big or a small particle? And of course it does. This is a study 2021. If you can see, they kind of highlighted the part of the lung that actually contributes to the deposition of different particle size. So as you can see, the 0.1 microns go all the way deep to the lung. PM 2.5 is actually deposited in the upper airways and the lung, and PM 10 is almost deposited in the mouth and throat. That tells you that probably we have been going through measurement of PM 2.5 instead of PM 10, and this seems like a correct pathway to tackle the most dangerous particles in terms of the size in the air. There's, of course, studies in terms of depositions of traffic particles versus dust particles. This is also, I think, done in recently in 2019 and shows similar deposition. So really what matters is the chemistry of the particles, the size of the particles. These are all connected to the human health. Now, the question is that these are all outdoor air pollution. How many of those, or how much of those are infiltrated into the indoor environment? As we're talking about indoor air quality, you can see that there's quite a bit of infiltration. Even if you use, a MERV 13 filter or HEPA filter, you get quite a bit of infiltration. And as you can see in this recent study in 2020. We have quite a bit of infiltration from smaller particles. So not only smaller particles, PM 2.5 versus PM 10, are more dangerous for human health, as we have seen in previous slides. They infiltrated and ingress more into the indoor air by this ratio, as you can see in this study and many other similar studies. And the same here, we have quite a bit of infiltration of the particles into an indoor air. There are more pollutants. These are just particles from outdoor that are coming into indoor, but there are indoor air pollution as discussed in the WHO presentation. One last thing that we are making or building more airtight in future because of energy efficiency. That has an impact on indoor air quality and probably will impact the indoor air quality even further. So that's also a challenge with the future of more efficient building in future of climate. I'm going to skip through the transportation sector as looking into decarbonization of the transportation. Just to conclude, I'm just going to go through my slides very quickly. You can take a look at these slides. A copy of the slides are available for the organizer. You can request the copy of these slides. Thank you very much for your attention. This is my email address if you want to reach out. And there's also a list of references that I use for this presentation. Appreciate it. Thank you.
Amazing. Thank you, Dr. Husseini. It was really interesting, again, to look at the account of the particle size, really understand the impact on health and well-being, the impacts of climate change as well. And now we would like to introduce our third speaker with some regional insights from Saudi Arabia. Our third speaker is Dr. Khulud Al-Tassan, Assistant Professor and Head of the Preventive Medicine and Public Health Unit at the College of Medicine, King Saud University, joining from Riyadh, Saudi Arabia. Dr. Al-Tassan is an environmental health expert. She has collaborated with the Saudi Public Health Authority on developing indoor air quality guidelines and researching the impact of urban air pollution on health in Riyadh. Her current research explores the health impacts of traditional incense, bakhur, particularly on maternal health. Today, Dr. Al-Tassan will be sharing with us some of her ongoing work on air quality and from a deeper dive from this region. Floor is yours, Dr. Al-Tassan.
Thank you so much for this introduction. I'm very happy to be with you today. So, my name is Khulud Al-Tassan. I'm an assistant professor of environmental and occupational health, and I'm going to be talking about navigating indoor air quality in Saudi Arabia from both policy, culture, and research perspectives. So some of the topics that I'm going to be covering today, I know I have a brief amount of time, about 10 minutes. I'm going to try to squeeze in a lot of my experiences working on indoor air quality in the past few years. So we're going to talk about the challenges for indoor air quality in Saudi Arabia, the project that I worked with the Saudi Public Health Authority on creating guidelines for indoor air quality, and a community-based research project we've been working on the impact of bukhur on maternal health. We're also going to be talking about a clinical trial that links dry air to chronic cough. And I'll end with a few takeaways and future recommendations. So to begin, some of the challenges for indoor air quality in Saudi Arabia, the fact that geographically, environmentally, we live in an area with dust storms, extreme heat. So the population relies on being indoors all of the time and on using air conditioning. Additionally, there is widespread use of fragrances, especially Arabian incense or bukhur. The areas that we really need to focus on for indoor air quality include public spaces like schools, shopping centers, entertainment venues, workplaces, as well as residential areas. The core challenge that we have is trying to balance the realities of our climate and geography with our cultural traditions and also the requirements of modern health. So to start, I'm going to talk a little bit about this project that I did with Saudi Public Health Authority, otherwise known as Wiqaya, where we created indoor air quality guidelines um, for specifically schools and shopping centers. Some of the things that we really needed to consider when creating these guidelines and some of the challenges that we faced were that we need to address the needs of vulnerable populations like children, pregnant women, workers who are in, for instance, shopping areas or entertainment venues, and then people with chronic respiratory and cardiovascular conditions or the elderly. Additionally, we needed to take into account the fact that practices like burning bukhur and the use of fragrances in public spaces was widespread. And we also needed to manage stakeholder priorities. For instance, business owners, people who had bukhur shops or fragrance shops in the middle of a shopping center. We needed to consider that when putting out guidelines that may impact their business. Ultimately, the Public Health Authority was able to produce a comprehensive guideline document for indoor air quality, and they did emphasize having a fragrance-free environment in indoor public spaces. Some of the key recommendations included avoiding the use of scented products and bukhur in shared spaces, as well as implementing efficient ventilation systems, and quite importantly, routine monitoring and continuous risk assessments for indoor air quality. So they put this out, I think, last month, الدليل الاسترشادي للوقاية من المخاطر الصحية لملوثات الهواء الداخلي. And I don't know if it's available yet, but it should be available very soon. Next, I'm going to briefly talk about this project that I worked on that I felt very passionately about, which is using bukhur while pregnant, describing behaviors of pregnant women towards bukhur use, as well as the impact of that on maternal and neonatal health. It was designed as a prospective cohort study. We had a sample of 268 pregnant women from King Khalid University Hospital participating. We surveyed their behaviors towards bukhur. And then after they delivered, we went back and looked at the medical charts and the Health Hub neonates. We're still analyzing the data from this study, so I'm going to give you some preliminary results. So first of all, just to describe, almost 90% of the participants said that they did use bukhur at home, the majority using coal bukhur as opposed to using an electric mabkhara or an electric incense burner. So they would use the bukhur where you have to burn a piece of coal and then put the bukhur on top of that. We also asked them about the purpose of using bukhur, and the majority did use it as a home fragrance, especially after cooking, but more than a third used it for personal use. So you can imagine how that would expose them to higher levels of particulate matter and other chemicals directly in their kind of breathing space. And then we also asked them whether their bukhur using habits had changed at all while pregnant, and the majority said it had not changed, and some said it had even increased. Only a third said it had decreased or stopped. So the key findings from this study was, first of all, there's really high use of bukhur among pregnant women, which was an interesting finding on its own because we consider it a risky behavior and a source of indoor air pollutants. The other thing that we found when we were looking at maternal health outcomes was that people who used, pregnant women who used bukhur more than once a week had a higher risk of developing gestational diabetes. And this is actually in line with other studies that looked at people who worked with bukhur in bukhur shops. They also found that they had higher levels of diabetes. So finally, I'm going to talk very briefly about this clinical trial that I am working on. It's ongoing with a team from Sensory Cloud, and it really builds on the work that was done by Dr. Fan Kung and Dr. David Edwards. The hypothesis is that dry air can contribute to chronic cough by dehydrating our mucous membranes in our airways. This leads to inflammation and hypersensitivity, which leads to cough. And the idea is that in a changing climate, we have lower humidity, higher temperatures, lower humidity, and this is going to become even more exacerbated. The intervention that we're doing is an inhaled hydrating aerosol to rehydrate airways. So it's basically a spray you spray into your oropharynx that contains a certain level of salts. We're doing this as a randomized control trial. The participants do 2 weeks on the spray, 2 weeks on a placebo, and we monitor their cough using a cough monitor watch, like a wearable. Ultimately, we're trying to determine if using this spray will reduce the frequency of their cough. So finally, from all of these projects that I've been working on, my takeaway and my perception is that to put together policies for indoor air quality, we need to have an integrated approach, collaborating with all stakeholders so that we can create guidelines that meet their priorities, whether health or otherwise. At the same time, we need to be able to protect the most vulnerable, and that will include children in school, workers, the elderly, pregnant women. And then continuous monitoring is really, really essential. We need to understand the current situation, how the interventions we are implementing are affecting indoor air quality, and what are the potential emerging issues in indoor air quality are. And finally, as an academic, as a researcher, of course, I think that we need to conduct more targeted studies to build the evidence base for indoor air quality guidelines and interventions. So thank you so much for listening. Feel free to ask me anything in the Q&A, and if you don't have time today, then feel free to email me about any of these projects. Thank you so much.
Thank you, Dr. Altassan. This was really interesting. Honestly, the impact of Bakhur use on maternal health really requires urgent interventions. And as you mentioned, studies are important in order to gather more data, especially in regions where there are data gaps, and to be able to then knowledge share and build on this actions and interventions together. And it's interesting that you mentioned real-time monitoring as well to understand and prescribe the next course of action. So, which leads me to introduce our next speaker, Mr. Frank Hammes, Global CEO of IQ Air, joining us from Switzerland. IQ Air is a Swiss-based technology company that develops technology solutions to help individuals, organizations, and communities increase their environmental awareness, reduce air pollution, and improve air quality in homes, schools, and public spaces. They operate Air Visual, the largest global real-time air quality information platform. And also, they're an official partner of the United Nations Environment Programme, supporting their global effort to fill air quality data gaps. Mr. Hammes will look at the 3 indoor environments today, delving in deeper into homes, schools, and workplaces, among other things. So we'll leave the floor now to you, Mr. Hammes.
Thank you, Lama. Thank you for the introduction. I appreciate it. And I'm glad to talk to you today about how to improve indoor air quality, right, in the context of the MENA region, which, as we heard, has some special challenges, both indoors and outdoors. Yes, so we heard already, and Lama, you mentioned that we, on average, take 20,000 breaths a day. And that's a staggering amount of air, right, that goes into our lungs. Actually, when you work out the math, it's 12 kilograms of air going into our lungs. And we ingest about 2 kilograms of food and maybe two liters of fluid. So, and with all of this air, we are providing a direct pathway of air pollution into our body. Every cell in our body contains air pollution. So I think one of the big challenges that we have to fight is the awareness. And in order for us to be able to create this higher awareness, um, is a big challenge because we are by nature programmed to be unaware, even complacent about the air that we're breathing. And often it takes an extraordinary event for us to be able to get in touch with the gravity of air pollution. And the health effects are manifold, as we've heard from some of the other speakers. But there's even things that we not traditionally have connected with air pollution, such as Alzheimer's, diabetes, ADHD. And so it's quite important for us to bridge this awareness gap. And the way we can do this is by measuring. And governments have been measuring for years, right? We have governments that are measuring outdoor air quality, have established standards to allow them to quantify air pollution, to regulate air quality outdoors. And in addition to that, new sensor technologies have now been available that also allow individuals, communities, schools, social enterprises to monitor the air quality both indoors and outdoors. Because government stations are far between, right? Governments have to make tough decisions when they're putting up expensive measuring equipment, where to place them. So putting up equipment where you are and being able to measure indoors and outdoors makes a big difference. And IQAir collects, validates, harmonizes, and publishes air quality data from over 30,000 outdoor stations in over 150 countries. And if you're interested, you can come to our website or download our app in your app store. The information is also available on the website of the United Nations Environmental Program. And while outdoor air quality may not always be the best in the MENA region, there's hope. We're spending over 90% of our lives indoors, at work, at home, in school, and in public spaces like shopping centers. So I think the region has a tremendous opportunity, because these are all air-conditioned spaces, to actually improve air quality. And since indoor air has an outsized impact on health, actually this can make an outsized impact on public health in general. And we now see that the air quality that a family is exposed to in Dubai, Abu Dhabi, Riyadh, or Doha does not need to be worse than that of a family in Norway, New Zealand, or Switzerland. But it requires us to understand these indoor environments. And as previously mentioned, continuous monitoring is an absolute key to that, because a good result in terms of air quality doesn't happen by chance. It needs to be a deliberate connection of building technologies, measuring technologies, and the individual actions of everybody who could be affecting indoor air quality. So what are the solutions to better indoor air quality? Well, there's really 4 key actions that are needed. Measurement of air quality, the elimination of indoor sources, or at least the reduction of indoor sources of air pollution, the proper ventilation of indoor spaces, and then the application of filtration to fresh and indoor air. So how do we monitor indoor air? When it comes to measuring indoor air quality, many people get confused, and even scientists get confused sometimes. What are the pollutions that we should monitor? Where should we monitor? How long should we monitor? And how do we make sense of the data? While scientists are often interested in measuring as many pollutants as possible, it is important to keep in mind that over 90% of the health impact from air pollution comes from a single pollutant category, referred to as PM2.5. And PM2.5 are tiny pollution particles from combustion, from dust, from chemical reactions, as well as from biological sources. Outdoors, these major sources come from human activity and nature. Traffic and industrial activity are the main human-made sources of PM2.5. Some of the sources for PM2.5 outdoors, as we heard previously, is smoke from wildfire, ash from volcanoes, and in the MENA region, wind-blown sand and dust. The major sources for PM 2.5 in the home or inside in buildings, in classrooms, in offices, in the MENA region, for sure is outdoor PM 2.5 infiltration through cracks and openings. In larger buildings, poorly designed ventilation systems often bring in high concentration of PM 2.5 into buildings. But there's also plenty of indoor activity that generates particles. And as we've heard, incense burning, parkour, tobacco, shisha smoking, and last but not least, cooking activities, especially frying, can generate pollution levels which rival those on the worst days outdoors. And what's important to realize is you do not need to have air pollution. Air pollution will spread throughout a building, even if it only occurs in one area of a building. We have these transport systems with air conditioning systems that really can spread these quite effectively. In addition to measuring PM 2.5, we need to measure CO2 because many of our homes and schools don't get enough fresh air from outdoors. And while CO2 is naturally present in the air and is not a toxin, it is an indicator of the accumulation of other gaseous pollutants. So CO2 is mainly produced by human respiration. Urban outdoor contains about 450 ppm of CO2. And each of us exhales 30,000 ppm of CO2. So we're essentially engines converting oxygen into CO2 in closed spaces. And we have to do something about this. When it comes to CO2, research has shown that already at very low elevations, at about 700 ppm, we can see adverse effects in terms of cognitive ability. Most homes in the MENA region actually have CO2 levels between 500 and 1500 ppm. These slightly elevated levels in homes can result in reduced concentration and generally the feeling that the air is stuffy. Many classrooms have CO2 levels between 1500 and 5000 ppm. This can cause drowsiness and headaches and poor cognitive function. And in offices, actually the worst place in terms of high CO2 levels are conference rooms where we see CO2 levels that can exceed 5000 ppm. So the learning and working environments where concentration and critical thinking are the most important, by virtue of poor air quality, are often the places that make cognitive work the most difficult. Here are some guidelines about how to achieve good CO2 levels. Ultimately, you need outside air. Unfortunately, if you live in a building that's more than 10 years old in the region, you will have difficulty achieving adequate CO2 levels. And maybe additional technology will be necessary, especially in schools, to bring down these CO2 levels. So where should you monitor? People often ask, where do you put this in the home? Our recommendation is to monitor at least in one area in the home, and that should be the living room, and ideally in each occupied bedroom, because every one of these indoor spaces will have different challenges. Bedrooms many times have high CO2 level because you keep the doors closed, you have the windows closed, and so the air exchange with the outside might be reduced. And in an office, you should measure basically in densely occupied spaces, and in a school, every classroom ideally has air quality monitoring. And the most important aspect is that this monitoring is continuous. You can buy services where you can have somebody come in and monitor air quality for an hour or for a day. Ideally, you need to do this continuously. Because air quality can change from hour to hour, from day to day. Continuous air quality monitoring allows to discover the periods when air quality is poor and understand the causes. Continuous monitoring allows to discover trends and correlations. And many of the air quality monitors today are able to connect to the internet so you can see those results over time and see what activities make the biggest impact.
Thank you, Mr. Hammes. This was really insightful, the importance of real-time monitoring in order to target tailored interventions. It was interesting to also dig deeper into CO2 levels and PM 2.5. We'd love to jump to the Q&A to get more insights from you as experts and answer some of the questions. I guess this would be for Dr. Safi. How is air quality related to sustainability, and how can we align which sustainability goal with air pollution? I know you mentioned a specific target, so maybe you can revisit that conversation.
Yes, absolutely. When it comes for sustainability, the indicators that we use, it's for indoor, the reliance on clean fuel and technology, while for ambient, we use the other indicators like population-weighted exposure to particulates matter 2.5 as an indicator for other air pollutants. For interventions, when it comes for as an interventions for sustainability, we're working closely with the healthy cities to move or shift for more cleaner, let me say, ways of or reducing the emissions from transportation industry, green zones, etc. There's a lot of documents related to this. I can share it with you to be shared among the participants. I hope that addresses the question. And thank you.
Thank you. Thank you, Dr. Safi. This is for you, Mr. Hammes. Are there any specific risks to indoor air quality found in the Middle East which have been more prevalent than other parts of the world? I know you've done monitoring all over. So if you want to comment a bit more on this question.
Yeah, I think as we mentioned earlier, the Middle East has challenges, cultural challenges, right? You have more tobacco smoking going on, shisha smoking, and then the incense burning. And I think this was quite surprising because in the rest of the world, we've seen that tobacco smoking really has gone down dramatically. The social acceptance has gone down. And we're now dealing, I think, with a challenge of this will not go away overnight. But at the same time, we um, we see that people are thinking about it, and entertainment rooms specifically are something where people are now understanding if they can do something to isolate the smoke in these areas, at least the rest of the house and the rest of the family is not becoming victim to the secondhand smoke. So I think it's definitely a journey ahead that maybe is 10 years backward from some other places where we've made more progress. But I think some of the work from the researchers and community activism and government entities will help on that.
Amazing. Thank you, Mr. Hammes. I think maybe Dr. Khulud, you can build a bit more on that from the perspective of your research on Bahur. There's a question here about fragrance candles. Are they as bad as Bahur? And what about these scented machines, these fragrance emitting machines that we find very often in schools?
Yeah, this is actually like a personal kind of crusade of mine. The problem with a lot of these fragrance machines or candles or anything with fragrance is that they're not really regulated. As long as a company says, it's parfum or fragrance, they can put whatever chemicals in there and say, it's proprietary information. So one of the biggest issues is that we don't actually know what's in them. We know that they're not going to be natural oils for the most part. For the most part, they are chemicals that mimic the smell or the scent of things that we find naturally in the environment. There is a move kind of globally for clean fragrance, and you'll see that at places like Sephora. They'll have their perfume section has a clean fragrance line where they are transparent about what goes in them. But it's my personal perspective that in public spaces, you should not infringe on people's right to clean, fresh air with these fragrances. And it's also kind of changed what is normal. It is normal to smell the air as it is. It is not normal that everywhere you go has a scented kind of chemical fragrance.
Thank you. And last but not least, a question for Dr. Husseini. How do you best manage air quality close to highways or urban centers with high pollution levels from the transport sector, especially since the most affected populations live in dense areas and may not be able to afford air purification systems indoors?
Yeah, in terms of the population that are living close to home, it's a huge discussion right now on the environmental justice piece, and we are exposing the vulnerable communities near to roads and major highways with more pollution. Pretty much similar to any other PM 2.5 or any particle that we have a solution for indoor air quality. That's the same for transportation. Better ventilation, probably more filtration, airtight buildings. In one of my slides, I showed that the air tightness actually reduces PM 2.5 inside homes, although it increases the CO2, as Frank mentioned about the quality or the amount of fresh air that will be trapped inside the home. But other than that, there's nothing specific that we can do about the transportation emission from major highways. Plus, as I again mentioned in one of the slides, there are smaller particles, more dangerous particles. They're coming from tire wear, exhaust, elemental carbon, all sorts of metal oxides and metals. So compared to natural dust, they're even more dangerous, smaller, and more chemically hazardous. So we have to be very careful if the house is very close to highway and exposed to the highway pollution.
I think this opens room for constant monitoring as a prerequisite for action because we cannot change what we don't understand and what we cannot measure. So I think we'd leave with that. Thank you for the questions and thanks for the speakers for their contributions. We learned about the health impacts of indoor air quality today and what we need to do to first understand and address these challenges with opportunities. This is an ongoing series, so this is one of three. The next one, we will dive deeper into the role of data to inform tailored interventions for both private and public sectors. And we'll run this around May or June. And the final session will look at the role of technology and different innovative solutions to tackle the problem of indoor pollution and improve indoor air. And we'll hopefully have this running in September, October. These are multi-stakeholder conversations. So if you have the vested interest in this particular topic, whether from the public sector, private sector, from academia, or our solution providers, please do stay in touch, reach out, scan to register for the upcoming webinar. For either of the upcoming webinars or both of them. And we look forward to seeing you all. With this, we conclude and we thank you very much. Have a great rest of the week ahead.